Good day. My name is Dr. Doreen Stiskel. I am chairperson of the Department of Physical Therapy here at Seton Hall University. I welcome you to listen to our audio recording of our very special dual degree program that allows students to enter as freshmen to obtain a Bachelor of Science in Biology and a Doctor of Physical Therapy degree. Physical therapists are unique healthcare providers. They're known as movement specialists that help individuals across all phases of life, whether it's their balance, whether it's the ability to attend classes in the hospitals, in the community. We provide those necessary educational experiences to prepare today's practitioner for tomorrow's practice environment. So how does one start to become a physical therapist? Let's talk about the dual degree program. It's something we call a 3+3 program. Your first 3 years of study is dedicated to the traditional undergrad learning experiences toward achieving a Bachelor of Biology degree. And then the second 3 years are dedicated to becoming a physical therapist and engaging in the professional study. So instead of having 4 years of undergraduate study and then 3 years of professional study, this is actually a complete educational program in 6 years instead of 7. Students will be awarded that Bachelor of Science after the 4th year, which includes the first year of the professional program, and then they will receive their DPT after completion of the professional program at year 6. Students are admitted into this Bachelor of Science DPT dual degree program with having what we call a guaranteed seat. For those accepted as freshmen in the fall semester, as long as you maintain your GPAs, you take the required prerequisite courses and they are completed successfully, and also do just a few other steps, students will automatically have preferred preference and will begin the professional phase in the July after their junior year. Students are expected to complete each portion of this dual degree in the appropriate 3-year time frame. So students do that whole first 3 years of undergraduate study, and then they complete the full second set of 3 years of professional study. So how do students get admitted to this dual degree program? So for those high school students considering entry as a freshman, you must have a minimum GPA of a 3.2. The math SAT needs to be at a 590 or higher, and the ERW SAT needs to be at least 580 or higher. The Seton Hall University also accepts ACTs, and those scores need to be 25 or greater. So Seton Hall's learning opportunities do also include scholarships. Seton Hall provides over $96 million a year in aid to our students. 98% of students also receive some other form of aid to supplement as well. 97% of students receive a grant or scholarship directly from Seton Hall. Those students are automatically considered also for a merit-based scholarship when they do apply to the university, and will be notified of any eligibility for awards once they are accepted. So what does the undergraduate experience look like? What are those prerequisite courses that students need to take to be well prepared to begin that professional phase? These are almost identical to those required prerequisite courses that any DPT program across the country would require you to have. And the first includes General Chemistry 1 and 2, including hands-on labs. General Biology 1 and 2 with those labs. Calculus 1, Introduction to Psychology, English 1 and 2, General Physics 1 and 2 with labs, and most importantly, Anatomy and Physiology 1 and 2. These courses all represent foundational learning of the sciences, the communication, and the understanding of human behavior so students can be successful in the graduate portion of this dual degree program. In terms of if you have AP and or college credit, Seton Hall University does accept AP scores of 4 or higher. We recommend that you can take AP courses in English, history, language, ethics, philosophy, and calculus. While you might have AP science courses, for the students enrolled in this dual degree program, they really only count as electives, and they will not waive any of your SHU science requirements or your DPT requisite courses. It's important for you to be successful that these classes are fresh and at that level that best prepares you to be successful moving forward. Any college level courses taken during high school will also be accepted if you received a grade of C or higher and it is reflected on a college transcript. So what also makes Seton Hall unique? This dual degree program offers students the opportunity for personalized mentorship. Faculty are accomplished scholars, practitioners, researchers who all conduct grant-funded research or other experiences that really foster your development as an undergrad and graduate student. You'll have the opportunity to work side by side with other students in the classroom that include clinical and research lab experiences. Many faculty also will serve as advisors and mentors for you so that your experience is personalized, unique, but also forward thinking toward your goals and aspirations. Students do meet regularly with their advisors, and they will assess your current standing and also ensure that you select those right courses and be guided through the transition toward that DPT phase. How does one go from those first 3 years seamlessly into the 3 years of the professional phase? This guaranteed seat. Once you're accepted as a freshman, as long as you maintain each of these benchmarks along the way, your seat is waiting there for you. The first is you need to have a cumulative GPA of 2.7 by the end of your freshman year. At the end of your sophomore year, you need to have a cumulative and prerequisite GPA of 3.0. At the end of the junior year, immediately before transitioning, all students need to have a cumulative and prerequisite GPA of a 3.2. Each student needs to earn a C or higher in all those prerequisite courses that I talked about, and they also need to have a C- or higher in all non-prerequisite science and math courses. And then the one last piece is we do require students to have a minimum of 50 hours of observation with a physical therapist. This is a big time commitment toward your professional future. So working alongside and observing a physical therapist will help you to make sure not only this is the field that you want to go in, but also help you to establish potentially another mentor to help you along the way. Admission into the graduate professional phase. What do you need to do? Students who are not accepted as freshmen into this dual degree student must complete a baccalaureate degree and take the GRE. Our Seton Hall dual degree students do not. Admission to the DPT programs nationally are very competitive. So your seat, as long as you meet those points along the way, is waiting for you at the end of your junior year. And at that time, all of your undergraduate requirements need to be completed so that you're ready to start the actual professional phase in July. So the DPT program, what is this about? Our newly revised 3-year Doctor of Physical Therapy program prepares students to be entry-level clinicians who are autonomous practitioners in physical therapy. An autonomous practitioner is somebody who now is able to make decisions about their patients and clients by themselves. And we train students to be successful in diverse practice settings. Our program is accredited, and the faculty are currently working on our reaffirmation for accreditation right now. We offer a very comprehensive curriculum that provides learning experiences that not only prepare you for direct patient care, but also so that you can educate others, whether that's peers, other health professionals, patients, family members, but also in research and evidence-based practice. Patient care is just critical. Whether you're working with people in community settings, people in hospital-based practices, or in community settings as well, this program will prepare you to be able to engage effectively. Our graduate coursework, we said, begins in the summer, in July, immediately following your junior year. During this 4th year of undergrad, but really represents that first year of the professional phase, students will earn 42 credits in the DPT courses that fulfills the requirements for your bachelor's degree. And as I said previously, this is when you will get that bachelor's degree, and then you only need to complete an additional 69 credits toward the DPT experience. Coursework begins with a blend of courses that really promote you as this movement specialist. So whether it's a foundational science like anatomy and including true cadaver-based experiences, or neuroscience, or physiology, or kinesiology, those coursework, those foundational principles will be mixed in with actual real-life experiences, such as how do we teach people to mobilize in wheelchairs? How do we teach them to walk? How do we teach people to exercise appropriately for health and wellness? The graduate coursework also includes clinical-based courses where we bring in individuals who act in simulated experiences, or for individuals from the community, so you really understand how do you become a physical therapist from the start. Students also learn about their professional roles, the ethics, the critical thinking and reasoning, and evidence-based practice from that start as well. That encompasses many aspects of what a practitioner today needs to be able to do. The program promotes growth so that your hands-on skills and your communication as an interprofessional practitioner and educator are sound. It is important that today's physical therapists communicate with doctors, with nurses, with nurse practitioners, with other healthcare practitioners such as OTs, speech pathologists, social workers, so that we can maximize people's quality of life. And at the end of this program, the students are now eligible to take the National Physical Therapy Licensing Exam. This exam is important because it allows you to be able to begin your career as a physical therapist. And as I said, this is a very robust field that includes a lot of collaboration, a lot of hands-on learning, and a lot of opportunity to really interact with the faculty. Seton Hall is known as a school that promotes servant leadership. So besides your in-classroom opportunities, you will have an opportunity to grow as a servant leader. This is a great picture representing our organization of physical therapy students. And you could see them assembled together in their great pink t-shirts. The pink represents the advocacy for breast cancer research, and it was also including physical therapy, it was also including National Physical Therapy Month as well, which both coincide in October. What is unique about this physical therapy program compared to some of the others is that we really do have an optimal class size of 40 students. This allows one-on-one, very close monitoring, advising, and mentorship from the family, from the faculty. But it's not, I use that word family because I do think sometimes we really do create an environment that feels very family-like. Our clinical experiences. Students in the program all complete 32 weeks of full-time clinical internships in 3 different practice environments. This all occurs during that final year of study. So you've had 2 years of on-campus and some short integrated clinical experiences so that you're prepared to work in that variety of outpatient experiences. And that could be experiences in the orthopedic world, the sports world, caring for individuals with neurological or cardiopulmonary dysfunction, or even some other medical and surgical conditions. These clinical experiences, as I said, are supplemented by very short ones as well. We do have patients coming to campus so that they serve as real-life studies. We have what we call standardized patients, so you get to practice with actors who really knew how to role model different conditions so that you're prepared to think critically on your feet and in the moment. We visit various healthcare centers to highlight specific treatment approaches. This might include visiting a spinal cord injury unit, or going to a nursing home where patients are on ventilators. It might be going to an orthopedic outpatient practice where you get to practice some of your exercise skills with those individuals. And all of these help you to enhance interprofessional communication and practice. But what's also unique, these experiences just aren't regionally. We do have the opportunity to place students not only nationally, but at clinics internationally as well. And here's just an example of what it looks like when we bring individuals from the community in so we can do a health risk assessment. So who are these faculty who lead these exceptional experiences? The program has 13 full-time doctorally prepared faculty. They are recognized as true leaders and effective teachers throughout this program. They have various areas of clinical expertise that might be in orthopedics, pediatrics, geriatrics, neurology, ergonomics, manual therapy. They might have themselves gone on for further education by doing not only academic doctorates, but also fellowships and specific research-based projects. But those aren't the only faculty that you're going to interact with. We have over 24 current practicing physical therapists who act as adjuncts and lab assistants so that they can provide you with that real life, what's happening in the clinical experience as you're learning. As I said previously, faculty not only teach, but they do research and they are true servant leaders. This gives students learning in this dual degree program the opportunity to be mentored in different ways and moving forward. And so here's an example of one of our DPT teaching spaces. This is one of our adjuncts leading a classroom, and you can see we infuse new technology in there to really make sure this is an appropriate learning experience. Our outcomes are excellent, so why come to Seton Hall? Our DPT program has had over 350 alumni since we graduated our first class in 2005. Look at these excellent graduation rates. The DPT program for the last 3 years really boasts wonderful outcomes. In terms of that ability to communicate others, our students at the time of graduation all present in a research day and an evidence-based practice day to communities of interest so that we know they are prepared to even go out and do national conferences. Our students in their final rotation all meet the expectations of entry-level practice. At least 1/3 to maybe 40–50% every year also are deemed beyond what is considered entry level, and they're noted for their exemplary work. Our clinical instructors report our students excel in areas of professionalism, clinical decision making, cultural competence, which includes empathy and caring when they're placed in different practice environments. I think most importantly, it's good to note that we have a 100% pass rate on that National Physical Therapy exam every year since 2014. And this is important because this licensure exam leads to your ability to enter the profession. In terms of some other outcomes, those clinical rotations were important because many students are offered employment opportunities there. So Seton Hall students, 100% over the last 4 to 5 years report that they've had a minimum of one job offer within a 1-year time after graduating. And they can be in many different practice environments. And so you can even see one of our alumni here has chosen to work in the armed forces, and she is a member of our Air Force physical therapy team. Students will learn at the brand new Interprofessional Health Sciences campus. I offer you the opportunity to go to the website and to look at these wonderful spaces that really represent physical therapy practice today. This is our unique building in Clifton and Nutley where all the PT classes will be held. So I thank you for your time, for your interest. Please come visit our website so that you can learn more about the program. And since this is an audio recording, we can't take your questions in person, but please go to our website and we welcome you to the Seton Hall experience. Thank you.